Well, thank you very much for having me today. I feel incredibly honored to have received the invitation to address your graduating class. And I should start off by saying congratulations to each of you for making it to this point. I know it hasn't been easy, particularly in the past year, given what we've all endured, and yet the world is ready and waiting for you. So thank you in advance for your incredible service. And I have to also thank Dean Finnegan for his years of service as well, serving you all, recognizing that this will be his final commencement and he'll be retiring later this year. So hopefully it's not premature to wish the dean well in this transition that I'm sure is well deserved. It's just such an honor to be able to touch the lives of students throughout one's career. I know that it's something that I strive to do in my own, and I'm sure he's done quite well in that regard. And finally, I have to give my greetings to Trish Alexander, a student speaker who will take the stage after me. I am glad to go before her because I'm sure that she will bring the fire with what she has to share with you all. It's pretty incredible and impressive to get to this point and finally graduate and somehow find the reserves to deliver inspiration and wisdom to one's classmates and future colleagues. And so I'm already a fan, Trisha. Good luck. I will be also ready and waiting for you to teach me something new with what you have to share afterwards. But I won't belabor too much longer. I will gladly get into what I have to share with you all today. Again, thanks for having me. It has been a pretty interesting time to work in public health, as I'm sure you all can imagine, and maybe you've heard from your instructors or even experienced yourselves, for those of you who are working while earning this particular degree. The world now hopefully understands the value of public health and what we each bring to the table. And it's really a privilege to be able to serve in this capacity. And yet it's hard and it's heavy. And there's a lot that comes with it. And one of the things that does keep me up at night is this question of the story that we will tell whenever we're on the other side of this experience we've all endured over the past 15 months or so. At some point, COVID will end, or this version of what we've been living through well. And I think we will all ask ourselves, what happened, right? What role did we play? Did it work? Did it matter? Frankly, it's helpful to ask that question now in my mind. And so it is something that I've been doing actively myself, if only as a coping strategy, right? To imagine a future outside of the current state and wonder about the stories that we'll tell each other or ourselves. And I am even hoping that some of you will ask that question of people like me, honestly, knowing that you are entering this workforce with your own questions in this regard, and that you have the choice to either celebrate or criticize what's happened. Know that that's something I'm open to doing, as should others be in this space, and hopefully you will be once you take up the mantle yourselves. So as these questions come up, I think first off, it's important for me to explain why that's been so much my focus. It's really been because naturally our discussions, our deliberations, our decisions have consequences, and we've seen this play out a lot over the past year, right? We know this in effect, and we've always believed this to be true, and yet we've actually seen it in action, real time. And so, what, for example, has it looked like for us to have declared a global health emergency? There were even a lot of questions swirling around what and when to declare a pandemic, let alone the idea of, or the mandate even, to wear masks or to keep one's distance, and how you communicate that effectively to the general public, alongside a lot of those public health recommendations were the decisions to close borders or schools or businesses. And of course, that had ripple effects around the world. It was intended to affect the pandemic, surely, but also had incredible socioeconomic consequences. And yet, how the public at large receive this, those who don't spend their lives steeped in science or politics or both, was also really important to keep in mind. And we're not always equipped to handle that as public health professionals, and yet this was essential to understand, and it was important in getting people to actually act on what we imparted and to trust us as experts, as leaders in this space. So, given all these questions that were swirling and frankly continue to come our way, instead of trying to impart in this one speech the answers I would provide, I think I would like to step back and share the ways that I sort of ground myself, given the swirl of questions and considerations. The fact is, we don't always have all of the answers, or not necessarily when we want to have them. And that's been a part of public health this past year as well, is this openness to the evolving nature of the pandemic and our response to that. And that can be frustrating, including for practitioners ourselves. And yet that is our reality. So what are the principles that we can use to center ourselves and to know that, again, if and when we look back on this moment, we did our best for the most, right? Because that's really what our charge is as social servants, is ensuring that we're showing up in the right way for people at the most important time. And it's in such a time as this. So one of the principles I find myself leaning on is the importance of applauding science. And this is our opportunity to tell sort of a good news story, because we don't focus as much on that, I think. And we can definitely talk about a lot of the unproductive debates that have taken place around things like wearing masks or even working with WHO. And those are important, right? Because those offer their own lessons learned. And yet there are some really important lessons about what worked too. And I think in particular, when we think about the ways that researchers and practitioners and innovators have come together to develop these important products now that are saving lives, that's huge, right? And that's built on decades of investments and relationships and everything in between that allowed for it to happen. But we have a vaccine, several vaccines actually, in a matter of a year, right? After even learning what this virus is, let alone therapeutics and diagnostics that can also help us in the fight. And so I just think that, it's important to acknowledge the promise of science real time. It's really demonstrated what happens when public health leaders do come together. And it demonstrates how helpful and important it is when people trust public health. That's what we want ultimately. And so the more we can lean into that, even in those times when, we are finding ourselves at a loss for what to say or what to point to that's working, we can trust that there are things that have worked, right? There are advancements that we've made. There's a rainbow here in what we've done, and all is not lost in terms of the greater good. So that's one area that I lean on. Another principle, though, that I absolutely lean on, and where we haven't seen as much progress, to be honest, is the principle of advancing justice and recognizing that no innovation is really worthwhile unless it is reaching as many as possible who require it. And so, what has it looked like during this pandemic for us to ensure that we're reaching those in need everywhere they are in our country and around the world? And this has been a pretty hard chapter to write in this story, and one that thankfully is still being written. But we're at an important point where we need to recognize the legacy that we leave depending on our actions. And those are individual and institutional actions that will sort of change the course of what this looks like for a lot of people who need us to show up in the right way. And it's not just about us protecting ourselves, although that is arguably part of it. I think ideally, it's about doing what's right. And it's about really making a commitment to people who might not have a choice in the matter, right? And so when we think about what really leads to these inequities that we have seen, that COVID has sort of laid there, I mean, we've always known that health disparities were a reality, especially for the people who experienced them, and yet we've needed to be reminded in the midst of this pandemic. And ideally, we won't need a reminder thereafter. But we have to absolutely recognize the truths that have now been revealed yet again in terms of access or lack thereof, and make some real commitments to how we address those. I'm glad that our government has stepped up to make those types of commitments. And furthermore, we need to see all governments, including ours, follow through with real action. So that's something that guides me in terms of again these questions that we have about what more can or should be done, and perhaps something that can guide you too. I can't talk about justice though without also acknowledging everything else that's taken place around this pandemic that has added to its weight. So in addition to seeing Black and Brown people, for example, experience higher rates of hospitalization and yes, death as a result of this virus and its variants and everything in between. We also know that just living and breathing with these demographics has been difficult for these communities and individuals, and that's devastating. It should never be the case that where one lives or how one is born is really having as much of a negative impact as it has on someone's livelihood or life, period. And yet, here we are with having experienced this over the past year. And so it's recognizing the weight of coupling these two things, the pandemic with injustice, and how they come together is something that has weighed on me over time. And I'm sure it's weighed on many of you as well. And so I guess that brings me to sort of the third and final principle that I lean on and that I'd share with you all today. The importance of breathing, the importance of rest, the importance of acknowledging how hard a lot of this is or really can be. It might seem basic, it might even sound trite or cliche, but trust me, I know how hard the work is. I never thought it could be this hard. I never imagined that we would be working on the things that we read about in textbooks or saw in films or, maybe did a mock scenario about. I mean, this is sort of our, one of our greatest nightmares, right? Is living through a pandemic and, trying to save ourselves and the world, working together from what can be a really scary and understandably so risk, right, for each of us. And yet we have to last in this. We have to ensure that we're caring for ourselves in the midst of so much that we are trying to manage. Many of you have worked in labs or in legislatures, or perhaps in clinics or corporations, or you're walking into those types of roles. And so you should know that we are being tapped and taxed as local health professionals or public health professionals like never before. And so this is something that is the case today, will arguably remain the case for some time. And even if we're not dealing with COVID, right, we're dealing with a number of other conditions that require our attention. And so, it's okay to be tired, it's okay to be anxious, and wonder if you're doing it right, if you're doing it well, and it's okay to press pause and, step back and ask, okay, well, what can I do to ensure that I can sustain this energy and momentum in this journey and this fight? And because that's what we need, especially as you all are coming into this space and signing up to be supportive, to lead in the ways that I know you can. We want to be sure that you can do exactly that, right? It's a marathon, and sometimes it's a sprint. But most importantly, the journey is long, and so the story should be too. Please do keep that in mind as you move forward. So that's where I'll end things. As I said, there's a lot to look back on. I think the story is still very much being written. Know that you are welcome to write your chapters as well, and I'd be very much looking forward to reading what we all have to say about this journey we've been on together. I know you have no idea what's in store for you, or perhaps I can't fully imagine what awaits you here in the world of public health, but know that you are absolutely welcome and know that you're going to be great. Good luck, everyone.